While coronavirus is the infection that we've been concentrating on for the last 6 months, there's now another infection that we need to think about, which is an infection that kills hundreds of thousands of people a year internationally, and that is influenza, more commonly known as flu. As we head into the autumn and winter, we face the prospect of not only the second wave of coronavirus, but also the potential of influenza in the UK. Medical experts are very clear that whilst having either condition on its own could lead to people being critically ill, having both together is likely to be much worse. In many ways, it's very difficult to tell the difference between coronavirus infection and influenza infections, which was one of the reasons that it's even more important that we have coronavirus testing if we think that any of us have coronavirus. There is one thing that we can all do to help minimise the chance of us catching both coronavirus and influenza, and that is a very simple thing, and that is to get our flu jabs. So earlier this year I had coronavirus, which made me feel as ill as I've ever felt. The prospect of having influenza on top of that would have been terrible. The same is true that you could have influenza or flu and then also catch coronavirus. Because of that, I'll be getting the flu jab as soon as possible because it's the best way of protecting ourselves from catching flu.
These are the symptoms you might see if you get the flu.
You'll have a fever and you'll feel as though you're freezing cold, but actually you'll have a very high temperature and you'll be sweating profusely.
It's common to ache from head to toe. Everything hurts and it's an effort to move.
You'll feel incredibly tired with no energy at all and feel exhausted just by putting one foot in front of the other.
It's a dry, persistent cough that nothing seems to touch. You'll be really, really tired and you just won't be able to sleep.
And then, of course, there's the sore throat, and the dry cough makes it worse. It feels like sandpaper.
And just when you thought it wouldn't get any worse, it'll give you a headache.
For many people, you may lose your appetite. Even if you do eat, you feel nauseous and possibly be sick.
Just to round it off, some people even get diarrhoea and stomach cramps.
The phrase "it feels like death warmed up" could have been written for having flu. Most people say they've never felt so unwell, so why wouldn't you get the flu jab?
So if you do catch the flu this year, there's some simple steps that you can take. Firstly, you can take plenty of rest, which is really important so you can recuperate. You can also take fluid to ensure that you are well hydrated. You can also take paracetamol to ensure that you can control your temperature. There's no cure for flu. So the simple step that you could take is to ensure that you have your flu jab this winter.
You'd be amazed about some of the myths and excuses around the flu jab. So let's put some of those myths to bed forever.
The flu isn't serious, is it? I don't need the vaccine, do I?
As many as 650,000 people across the world die each year of flu, and that's only respiratory deaths. The actual figure could be much higher. Flu even affects the healthy people. Those with a weakened immune system are far more vulnerable.
Can the flu vaccination give me flu?
The flu viruses in the vaccine is inactivated, therefore you cannot get the infection. You might get a slight achy arm or a mild fever for a few days as your body gets used to the vaccine. However, you cannot get flu from the flu vaccination.
Are vaccines proven to prevent the flu?
Not 100%. There are many different strains of the flu across the world, but having the flu vaccine will give you the best chance of preventing getting the flu.
Is it better to get the flu than have the vaccination?
Anyone who's had flu will tell you that they never want to get it again. Having the jab will give you the best opportunity to avoid catching the flu and passing it on to your loved ones, colleagues and patients.
Should I wait to get the flu jab so that I'm covered until the end of the season?
That is a myth. You should get vaccinated as soon as you can because it does take time to get into your system and then it will cover you for the whole of the season. There's no benefit in waiting.
So the flu jab last year, so do you think there are need to have it again this year?
You do. The reason for that is the flu virus changes slightly every year. So the vaccine that you had last year won't be effective for this year, so you need to get it every year to make sure that you're covered.
So I'm pregnant, should I still get the flu jab?
Yes, pregnant women should get it. It's completely safe. Pregnant women have weakened immune systems. The vaccine is completely safe during any stage of pregnancy.
Is it true that only old people get the flu?
Anyone can get flu at any age.
Certain people are more at risk from serious side effects such as older people or those with some of the long-term medical conditions like heart, lung, liver or kidney problems, or if you have low immunity due to disease or treatments. Patients with long-term health conditions are 11 times more likely to die from flu than healthy people. Pregnant ladies are at greater risk as well. Healthcare workers are at an increased risk of flu compared to the general adult population, especially those working in a frontline clinical patient contact role.
So I've heard that the vaccine hasn't been tested. Is it really safe?
Yes, the flu vaccine is very safe. It's tried and tested in the same way as any vaccines are, and it's stringently tested prior to release.
You can't catch the flu that easily, especially if you are fit and healthy.
Flu is very infectious. It can spread by coughing, spluttering, sneezing, and the most effective way to avoid the spread of virus is through regular and thorough hand hygiene.
If I'm allergic to eggs, can I still have the vaccine?
Some people do have a severe egg allergy, so in that case they can still have the vaccine, but please let the GP or your doctor know so they have equipment ready in case you do get an allergic reaction. But even then, if you're really worried that you might get a severe reaction, we still have the option of taking the vaccine in hospital, and the GP can refer you for that.
It's very easy to get your flu jab. Basically, what will happen is I'll run through a series of questions with you just to make sure that you're safe, well and able to have the vaccine. For example, if you're allergic to eggs or you've had an anaphylactic reaction to the flu jab before, then you just sit back, roll up your sleeve, and the injection takes seconds, and hopefully, if I'm doing my job correctly, you won't feel it. We are COVID-19 safe throughout, wearing level 2 PPE, so there's no concerns there. Majority of people have a very slight sore arm that normally lasts for 24 to 48 hours. Some people, although this is rare, may get general aching and a high temperature for 48 hours. This is not the flu. The flu jab cannot give you the flu. It's just an immune response that your body is showing.
Regarding faith, all individuals can have the vaccine because it's not formed in pork gelatin. The vaccine is basically harvested in an egg yolk. Okay, so it's not harvested in pork as was previously thought, and that was the main worry, especially for Muslim individuals.
It's important for our members and ourselves to get the flu jab because it looks after the health and well-being of our patients and our members and their families. So we encourage everybody to get the flu jab. Staff started supporting and recommending to get this flu jab as soon as possible.
This year, I'd say, think really carefully about how you want to contribute to saving patients' lives and protecting yourselves and your families. Coronavirus is such a horrible illness to have, and the prospect of having flu on top of that with some terrible outcomes for ourselves or our patients is something that we should do everything we can do to prevent. So having a flu jab is a really quick and easy thing that we can do as part of the NHS that will save lives across the region.
I believe that 100% of our staff should be vaccinated. It's not mandatory, but we are encouraging it. It's shown to work. We want to make sure that we are not confusing flu and coronavirus COVID-19 at the same time. And that's why we've made a commitment that we are investing in those flu vaccines for every member of staff, every CFR member, every student paramedic that we're working with, and even our contracting staff that come in to work on our premises. We're making sure we are spreading that care and attention to everyone.
It's really important that we all protect ourselves first and foremost, because without each of us fulfilling our important roles, we won't have an ambulance service. So it's absolutely essential that we all take advantage of the vaccine in order to continue our important and essential work, keeping the ambulance service going on the front line, in our emergency control rooms, in 111, and all of the support functions working together to continue to provide a world-class emergency ambulance service across the West Midlands. It's absolutely vital that we all take full advantage of the vaccine this year to protect ourselves and our loved ones.
Make sure you get your flu jab as soon as possible.
Protect yourself.
Protect your family.
Protect your colleagues.
Protect your patients.